The process of actually thinking about what's needed to put in a building here has also been a very helpful process for us. This is not just a building for Geelong, it's actually a building for the whole of the Barwon Southwest region. We're going to have upwards of over 500,000 people within our catchment.
Probably one of the biggest growth corridors in the whole of the state.
We're providing women's and children's services for our local catchment, but then supporting other health services further west as well. A large catchment that goes all the way to the Victorian border.
In response to that, the government's realised that we need to invest in our birthing services. We're going to have a lot more young children in the area.
It's been useful both thinking about a building, but that's actually really helped us think about what areas do we need to grow. There's much more of a move to providing care closer to home.
Thinking about the future and improve the way that we do things.
We've brought the design, put it on the floor, underneath their feet, one-to-one scale.
This is how we're going to use it, this is how we're going to function in it, and does it actually work the way we think it's going to work?
To make sure that whatever feedback they've provided us with, they are 100% happy with what we're going to build.
We've been walking around the rooms in their real scale, and we've been looking at some of the design ideas that we've had all along and seeing if they actually work in translation.
Being able to see that and walk it in that environment allows you to get that right balance between functionality and actually having a really good, healthy environment for patients.
Across from me there are some barriers that we've put up at various stages to create the actual sense of the room. There's some beds, there's some hoists, there's chairs.
We all have a collective goal to make sure that this is functional. It works for the staff, it works for the patients, it works for the families.
So this is really in the detailed design phase where we're working out lots of the nitty-gritty and specifics, moving towards final sign-off of that.
Sometimes you don't understand the implications of saying, I want this, and what that means in functionality.
We're able to think about how many nurses are going to be in this room at a given time at certain times of day.
Some of the rooms are smaller than we thought and some of the rooms are bigger.
And we realised we could actually move a wall just slightly and create a little bit more bench space.
There's a few things I think from here that we need to take away and take back to our teams and rethink. And then I think we'll get back together with the architects and we give them that feedback. We're trying to consult as much as we can with the people who are actually using the hospital.
It feels very gratifying to know that you've contributed to such a big landmark project.